Go ahead. Thank you.
Hi, my name is Barbara Mendel, and I live in Highwood, and I'm in your district.
Hello, neighbor.
Thank you.
Yeah.
And I am concerned that we're delaying the process of trying to get insurance for workers. You know, it's across the board. We all need health insurance. And I'm not necessarily a proponent of the public option, but I do think that insurance companies have gotten rid of the sick people and allowed people that have paid health insurance, especially individual health insurance, to not fulfill their responsibilities to people that have contributed to all those years. And as a former small business owner, I dissolved my business to get group health insurance, because now that I needed it and I had a scare with cancer, fortunately it wasn't, but had I, after being a conservative and having owned my home and had IRAs and all my retirement money, I would have lost everything had it really been cancer. That's just got to stop. You know, we can't delay this. Maybe this option is not the best, but we can't do something now. And American workers need to be protected, and they need to be the ones that pay for the Medicare and Social Security for everyone else. If we don't have health insurance for all of us, we don't have our government at all.
I substantially agree with you on a number of points, because the centrist bill that I laid out, I think, will repeat all of the successes of California and none of the pitfalls of New Jersey. And common sense tells us that if we lower the cost of health insurance, we dramatically expand coverage. And then for those of us who are less fortunate, if we decide to provide some public assistance, and already $34 billion, as my one chart from 2004 shows, we will extend that much further if we have more reform. So I agree with you. If we have a number of the lawsuit reforms, we could take a couple of $100 billion off the cost. If we have national competition, and you can buy from anywhere in the union, then we will have a dramatically lower cost. If we can make sure that you, if you're an individual, get the same tax break that a big employer gets if you buy on your own, that will lower costs as well. All of that is the direction that I want to go into. So, go back and forth.
Congressman, thank you for your time. Thank you for coming here. I brought a couple documents. I printed out this morning. This is the Constitution of the United States of America. Only 18 pages. I also printed out the Bill of Rights, which is right here. I also printed out George Washington's farewell speech, compared probably to Barack Obama's acceptance and everything else. This is probably just a few pages short of what he did.
Sorry.
Being kind of facetious.
Yeah, but there's a seat there
It
I want to
shows that
sit
the
in.
politicians are doing a
You're
lot of
blocking
work there in
their
Washington
camera.
and getting very little done.
Well,
You're blocking.
I also,
This is for the
Congressman,
media.
know that you're
I know it is.
not
We got
very much
enough
a
of it here.
centrist, but you're a left-winger. And also I have to remind you guys that the politicians have two rules. One rule is to get in office, the other rule is to stay in office at any cost. Do not forget that the congressman's running for Senate in a year, and he will say whatever he can to make you guys happy. I'm not in Missouri, but I want you to show me. Don't forget, Barack Obama promised us during his campaign speeches that we would have the same coverage as you guys do, and that has been brought up again. Will you guys be under the same insurance plan as we are?
I am against HR 3200 and want it to be defeated because I don't think it's the right way to go. But if we do not have the votes, and if a public option is created, I will vote to make sure every member of Congress is under the lowest option.
I don't want to speak for anybody else here, but I do not want the government to run my insurance for me There must be tweaking done, I agree with the people here, but to totally trash the system is totally wrong. We have a wonderful, beautiful country here. I was not born in this country, but I'll tell you, I love this country. What's happening with immigration is an example of the government running amok. We have 30 million people in here illegally. I came here with my parents. We took physical tests. We had a sponsor. We did everything right. I do not want anybody coming to this country. And a couple of hospitals have closed down in Texas due to the illegal immigration. You guys must support the law. Don't change the laws.
And the blue shirt here.
My name's Anita DeRose. I'm from Glenview. Some things I've heard in all the discussions, I welcome this, ability to get together and discuss sanely. One thing is, I'm really concerned with the amount of money that I hear that lobbyists, particularly in the healthcare industry, are contributing to our elected officials. I would like to hear a comment about that. And another thing is, it disturbs me when people say the government. Aren't you the government? Haven't you been the government? Aren't we part of the government? Didn't we elect the government? So I think, saying the government is almost a slap in the face to Americans, because we believe we are the government. That's what makes us so unique. So
I was very much for campaign finance reform, was a backer of Senator McCain's and getting that through, but there's a couple of other campaign finance reform things I'd like to get done. Like, I would like to force everyone running for public office to disclose what they receive every night on the internet, so that you can what is happening. We're also worried about the role of lobbyists, etc. We're seeing a lot of that, for example, from the New York Times lately, and some of it concerns me. And when Congress gets back, I think we'll probably hear more about what's happening. Sir.
Congressman, thank you again. My name is Brian Dvorak. We met at the unemployment experience that you had at Harper. I want to thank you for doing something like that. I'm currently unemployed. I have to pay for my own insurance for my family. I spoke with Matt at your office. If I was covered through a big corporation, I would qualify under COBRA, because I am paying my own insurance, even though I qualify for unemployment. Okay? I don't get COBRA. I don't get zilch of that 65% coverage. I want to know why we're allowing loopholes like this to exist in our insurance bills, number one. Number two, my daughter is under mental, seeing doctors, etc. We've allowed, as an independent person paying the insurance bill, I'm forced to buy my own insurance. They're able to get away with saying you don't qualify for the same coverage as group coverage. There is limits, and they are able to apply them. If I was under group coverage, there are no limits anymore by law. When are we going to close these loopholes? And that's why I believe in the public need for a public option in all of this. The insurance companies are ripping us off.